Today we're going to talk about the relationship between TMJ, snoring, and sleep apnea. Hold on just so I can get this right. TMJ stands for temporomandibular joint disorder, also known as TMJD or TMD or TMJ syndrome. It's an umbrella term covering acute or chronic inflammation of the temporomandibular joint, which connects the mandible to the skull. Basically, it's a point in your brain close to the jaw that connects it to the skull. The disorder and resultant dysfunction can result in significant pain and impairment. Because the disorder transcends the boundaries between several healthcare disciplines, in particular dentistry and neurology, there are a variety of treatment approaches. Back onto how TMJ can affect you with your sleep apnea and snoring. Many people snore at night. This happens because the muscles in the neck and throat relax while a person is asleep, and this allows the tongue, soft palate, and epiglottis to contact the back of the throat, causing a constriction of the airway. When this happens, the close approximation of these tissues causes them to vibrate against each other, producing the sound characteristic of snoring. It is a problem especially prevalent in the short-necked people, older men, and obese persons of either sex. In many instances, the obstruction caused by the relaxation of the throat muscles is so exaggerated that the patient is unable to breathe at all. This condition known as obstructive sleep apnea, and it causes the patient either to awaken as many as several hundred times a night, or to jerk into a much lighter sleep phase in which the muscles regain some of their waking tone. In either case, sleep is very poor, and the patient spends much of his waking hours being very sleepy or actually falling asleep at inappropriate times. In addition to daytime effects, however, the inability to properly breathe while sleeping produces some nighttime physiological effects which can be pretty devastating. Heart rate slows, blood pressure rises, and the body's skeletal muscles can become quite active. This is especially true of the muscles of the mastication, chewing muscles. Thus, people who do not breathe properly at night due to obstructive sleep apnea are likely to grind and clench their teeth in their sleep. This causes all the symptoms of TMD discussed on this page, including headaches, tired jaw muscles, and earaches upon awakening in the morning. Therefore, persistent morning headaches upon awakening may be a sign of obstructive sleep apnea, and patients who sleep poorly, know they snore, and have these symptoms may be well advised to visit a physician and arrange to have a sleep study to discover if they are at risk of major medical complications arising from their obstructive sleep apnea. For more information, head over to our website by clicking the link below, or visit sleepapneastop.com. Sign up for our newsletter to receive everything you'll need to stop your sleep apnea and snoring once and for all.